Airlines announcing today it will require all its U.S.-based employees to get vaccinated. It's the first major U.S. carrier to actually mandate vaccines for all employees. Let's bring in ABC News medical contributor and chief innovation officer at Boston Children's Hospital, Dr. John Brownstein, for more. Good morning, John.
Good morning to you, Kara.
Well, United is joining now this growing list of companies that have said they will require employees to be vaccinated, including Facebook, Walmart, and Uber. So overall, what do you make of this strategy?
You know, I'm in favor. This really reflects the state of the pandemic that we're in now. You know, we went from trying to remove barriers to getting people vaccinated to now just making it harder for people to get back to their normal lives if they don't choose to get this vaccine. The reality is we did hit a wall in vaccination. We are seeing some upticks in states that are seeing that surge, but those series of carrots, those incentives didn't really work. And so now we're seeing these sticks, right? This idea that, you know, that people who decide not to get vaccinated will potentially have to face regular testing, social distancing, masking. It'll make it much more challenging for them in the workplace. And we know that this vaccine is our single best tool to getting out of the pandemic. And so, you know, yes, we were, creating financial incentives before, but now it's about fear of losing time to go get tested, losing your job, losing money if you get sick, or missing out on social events. And so while this isn't a mandate, clearly you can test out a vaccination, this really emphasizes the importance of a safe working environment and really emphasizes how important the vaccines are. I know in our health system, we're starting to push the vaccine, and that's a critical weapon for us to effectively take care of our patients.
You know, you talk about the fear, and as a parent, the one thing that I'm fearing now is my children and their health, because the number of children in the hospital are on the rise now. So does the Delta variant impact children more than previous strains of the virus? Do we know that? Or are we just hearing about cases in young people now because so many people are still unvaccinated?
Yeah, thanks, Kira. You know, I have the same fear. I have two young kids that are not eligible to get vaccinated yet. And so I'm concerned about that rapid rise that we're seeing across the country. And it's something that we have to be watching closely. You know, unfortunately, for those kids that remain unvaccinated, they are vulnerable to the Delta variant that is sweeping through this country. And it's so important for the adults around them to get vaccinated. And, you know, while most kids do not get seriously ill, a few will get seriously impacted by this virus, and some small number will die. And so there's not really any specific evidence yet. It's mixed data around whether Delta impacts children more. But just if you have more virus spreading, it's going to find the hosts that are unvaccinated. Unfortunately, that represents our kids now. And that's why additional mitigation layers are going to be so important, especially as we head into school. I know masking is very controversial, but, you know, for our kids that can't yet get this vaccine, you know, ventilation, social distancing, masking still represent our best tools to keeping them safe.
Agreed. And there's also renewed concerns now over potential super spreader events. 700,000 people are actually expected at the annual motorcycle rally in Sturgis, South Dakota. We cover this every year, and the CDC is saying that the source of widespread transmission last year did come from that rally. So what's your advice to people that are still wondering, okay, is it safe to go to events like this?
You know, I can't believe we're already talking about Sturgis again. It feels like just yesterday we were talking about this event.
Right, we were.
The super spreader event. We spoke about it. And, you know, last year we did see tens of thousands of cases result from that event. And this year, you know, we have the vaccines, but they're not mandated, and you'll have limited masking again. And now we have this Delta variant that's surging. And so, you know, we've seen this, you know, movie play out with other events. Even if they're outdoors, you will see super spreader events. And unfortunately, you know, we saw Provincetown, you know, Sturgis is like Provincetown on steroids with the numbers of people and the limited potential vaccination. We know in Meade County, where this event is taking place, has very low vaccination uptake. And so I'm worried about the inhabitants of that, you know, of Sturgis. You know, they will be potentially exposed to the virus, but then also the people that are returning home and the potential for that to create surges in under-vaccinated communities. So yes, as someone who's vaccinated, attending event may be lower risk, but overall it's helping just propagate this pandemic even further.
Yeah. Well, our medical team has such great sources, and apparently a source is now telling us that the FDA is expected to reveal its plans for booster shots by early September. So are there certain groups who should be first in line for those doses?
You know, more and more data is coming in, and we're recognizing that that extra dose may be helpful to a certain groups of people. Those would be immunocompromised people, so transplant recipients, cancer patients, people with HIV. That could help boost their immune systems. We know that the 2-dose regime may not have given them an effective response to protect them, especially now that we have Delta. And the data that we've seen is primarily these breakthrough infections, especially the severe breakthroughs, are happening in our immunocompromised population. So this advice to get that third shot to this specific group of people makes a lot of sense. We'll likely see that come through in September. But for the broader population, we still see these vaccines working. There's no significant body of data to show that immunity is waning at a population level. And again, this just puts more focus on those that are unvaccinated. If you get those unvaccinated people immunized, that will serve to protect our vulnerable people while we wait for the guidance on booster shots coming through.
So glad to always have you, Dr. John Brownstein, to wade through all the new information every day. Appreciate you.
Thank you, Kara.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.